As men age, particularly after 50, their bodies go through significant changes, and one area that often doesn't get enough attention is the prostate gland. This small yet crucial organ plays a vital role in reproductive health, and daily habits, such as masturbation, can have surprising effects on its function. In today's video, we're diving into the first 3 unusual signs that can occur in the prostate of men over 50 who masturbate daily. Let's explore these fascinating changes. Point 1. Prostate gland overactivity. For men over 50, daily masturbation can lead to what's known as prostate gland overactivity. The prostate is responsible for producing seminal fluid, a key component of ejaculation. However, with age, the gland naturally becomes more sensitive to stimulation. When ejaculation occurs daily, the prostate remains in a constant cycle of producing and releasing fluids. This increased activity can result in a sensation of pressure or fullness in the pelvic region. For some, it may feel like a mild discomfort, while for others, it could manifest as a lingering sensation of tightness. Although this overactivity isn't inherently harmful, it's a reminder that even routine habits can influence the body differently as we age. Paying attention to these signals can help you better understand your prostate's health. Point 2. Mild prostate inflammation, non-infectious prostatitis. The second sign to look out for is mild prostate inflammation, often referred to as non-infectious prostatitis. Unlike bacterial prostatitis, this condition isn't caused by an infection but rather by repetitive activity and stimulation of the prostate gland. For men over 50, daily masturbation can sometimes trigger this low-grade inflammation. The symptoms may include discomfort, a slight burning sensation during urination or ejaculation, or even a feeling of swelling around the prostate area. It's important to note that this type of inflammation is usually temporary and can resolve on its own with a bit of rest. However, if these symptoms persist or worsen, consulting a healthcare professional is advised to rule out other underlying conditions. Point 3. Frequent urination or nocturia. One of the more noticeable signs for men over 50 is an increase in urinary frequency, particularly waking up at night to urinate, a condition known as nocturia. As we age, the prostate naturally enlarges for most men, a condition called benign prostatic hyperplasia or BPH. When the prostate is stimulated daily through masturbation, it can further affect the bladder's function. The repeated activity can lead to mild irritation or additional pressure on the urethra and bladder, making you feel like you need to urinate more often. While this can be a nuisance, it's generally not a cause for alarm unless it significantly impacts your quality of life. Managing this symptom may involve spacing out activities or consulting with a doctor for tips on maintaining prostate health. Point 4. Diminished ejaculate volume. As men over 50 continue with daily masturbation, one noticeable change is a reduction in the amount of ejaculate produced. This happens because the prostate and seminal vesicles, which are responsible for producing seminal fluid, naturally slow down with age. Frequent stimulation doesn't give these glands enough time to fully replenish their reserves, leading to a decrease in ejaculate volume over time. This phenomenon is often referred to as a dry orgasm, where the sensation of climax remains, but the actual fluid expelled is significantly reduced. For older men, this might not just be a physical change but also an emotional adjustment, as it can alter perceptions of virility and sexual performance. It's also worth noting that while reduced ejaculate volume is typically harmless, it can occasionally signal underlying health concerns like dehydration, hormonal imbalances, or even early signs of prostate issues. Staying hydrated, maintaining a balanced diet, and consulting with a doctor about any persistent concerns can help manage this change effectively. Point 5. Pelvic floor muscle strain. Another unusual sign for men over 50 who masturbate daily is the strain placed on the pelvic floor muscles. These muscles play a crucial role in ejaculation, helping to propel seminal fluid out of the body. However, with frequent use, these muscles can become overworked, leading to discomfort, fatigue, or even spasms in the pelvic region. Men in their 50s often experience natural weakening of muscle tone, which can exacerbate the strain caused by repetitive stimulation. This might result in sensations of tightness or soreness that persist long after the act. Some men also report difficulty sitting for extended periods due to the lingering tension in these muscles. Addressing pelvic floor strain involves exercises like Kegels, which can strengthen the muscles and improve their resilience. Additionally, taking breaks between sessions and incorporating other forms of physical activity can help maintain overall pelvic health. Point 6. Prostate fatigue. The sixth sign, and perhaps one of the more surprising, is what's known as prostate fatigue. For men over 50, the prostate requires more time to recover after frequent stimulation. Daily masturbation can overwork this gland, leading to a state where it doesn't respond as efficiently to stimulation, resulting in less intense orgasms or difficulty achieving ejaculation. This fatigue isn't just physical, it can also have psychological implications. Men may feel frustration or concern over the perceived decline in their sexual function, which can contribute to stress or anxiety. Over time, this can create a cycle where the mind and body both struggle to recover fully between sexual activities. Prostate fatigue is generally reversible with adequate rest and lifestyle adjustments. Reducing the frequency of masturbation, staying active, and focusing on overall health can help the prostate regain its optimal function. Furthermore, speaking with a healthcare provider about these changes can provide additional strategies tailored to individual needs. Point 7. Heightened sensitivity or irritation. As men over 50 engage in daily masturbation, one common sign is heightened sensitivity or irritation in the prostate and surrounding areas. The prostate gland becomes more reactive with frequent stimulation, which may result in sensations ranging from mild discomfort to outright irritation. This heightened sensitivity can manifest during sexual activity or even when sitting for long periods, especially on hard surfaces. Over time, this might feel like a dull ache or a persistent awareness of the prostate's presence. For some, this increased sensitivity is manageable, but for others, it can interfere with daily activities or intimacy. It's essential to recognize the body's signals and give it enough time to rest and recover. If irritation persists, consulting a urologist can rule out conditions like chronic prostatitis or benign prostatic hyperplasia, which often develop in men over 50. Point 8. Hormonal shifts affecting libido. Another intriguing effect of daily masturbation in men over 50 is its potential influence on hormones, particularly testosterone. Testosterone levels naturally decline with age, and frequent ejaculation can sometimes accelerate temporary dips in this critical hormone. This hormonal shift might impact libido, energy levels, and even mood. Men might find themselves less interested in sexual activity over time, leading to a paradox where daily masturbation could reduce overall sexual desire. Additionally, lower testosterone levels may affect muscle mass, fat distribution, and even bone health, making this more than just a sexual health concern. Fortunately, these effects are often reversible. Men can support healthy hormone levels by adopting a balanced diet, engaging in regular exercise, and ensuring adequate sleep. Limiting the frequency of masturbation and focusing on other aspects of health can also help restore balance. Point 9. Chronic pelvic pain syndrome, CPPS. Frequent masturbation in men over 50 can contribute to a condition known as chronic pelvic pain syndrome, or CPPS. Unlike traditional prostatitis caused by bacterial infections, CPPS is a non-infectious condition characterized by persistent pelvic or genital pain. The exact cause isn't always clear, but overstimulation of the prostate and surrounding nerves is a suspected factor. Symptoms can include a burning sensation during urination, discomfort in the lower back, or an achy feeling in the perineum, the area between the scrotum and anus. For older men, CPPS can be particularly challenging, as age-related changes in muscle tone and nerve sensitivity can intensify the discomfort. Treatment often includes physical therapy, relaxation techniques, and changes to daily habits, including reducing the frequency of masturbation to give the prostate and pelvic muscles time to recover. Point 10. increased risk of prostate fatigue-induced infections. Finally, for men over 50, daily masturbation can sometimes increase the risk of prostate fatigue-induced infections. While masturbation itself doesn't directly cause infections, the repeated stimulation of an aging prostate can weaken its ability to maintain optimal function. Over time, this can create an environment where bacteria have an easier time taking hold, leading to conditions like bacterial prostatitis. Signs of such infections include pain during urination, fever, or even chills. While these infections are usually treatable with antibiotics, they highlight how overworking the prostate can make it more vulnerable. To reduce this risk, maintaining a balance between sexual activity and rest is crucial, along with staying hydrated and following a diet rich in nutrients that support prostate health, like zinc and omega-3 fatty acids. Remember, the key is moderation. Taking care of your prostate as you age is about listening to your body's needs and adjusting your habits accordingly. Conclusion. To wrap up, the prostate is a small but essential part of a man's health, and its role becomes even more prominent as we age. For men over 50 who engage in daily masturbation, it's crucial to understand how this habit interacts with the natural aging process. From overactivity and inflammation to hormonal shifts and even increased susceptibility to infections, these signs are reminders that the body's needs change over time. The good news is that many of these effects are manageable with simple adjustments, such as reducing frequency, staying physically active, and adopting a prostate-friendly diet. If you've noticed any of the signs we've discussed or have concerns about your prostate health, don't hesitate to consult a healthcare professional. Open conversations with your doctor can lead to personalized advice and peace of mind. Remember, a healthy prostate is key to maintaining vitality and well-being in your later years. Thank you for watching. If you found this information helpful, be sure to like, share, and subscribe for more insights into men's health. Stay tuned for our next video, where we'll explore more tips on aging gracefully and staying in top shape.